Have you ever felt pain that wasn't pathologically explained? You didn't have a cut, a burn, or even a dysfunctional organ, and the only possible link between your pain and your emotional experience is from that stemmed from heartache from a lost love, a relationship that didn't work, seeing your best friend in pain and feeling excluded. This is best known as emotional pain. Pain is an experience of a negative sensation, and although it is predominantly physical, pain is not always manifested physically. In fact, pain and emotion have a lot to do with each other, and has been regarded as a catalyst for negative emotional states. Pain can cause a disruption in the individual's life that can cause senses of hopelessness and helplessness and anger, and can lead to isolation, sleep disturbance, and frustration. But how does the brain identify pain? It's through the use of pain receptors that the brain can detect mechanical, thermal, or chemical change higher than the individual's threshold. Once stimulated, a pain receptor transmits a signal along the spinal cord to the brain. Pain sensation starts from a bare nerve ending and travels along the axon carrying pain information. Certain axons have little or no myelin sheath around it, which therefore conducts impulses that are relatively slow between the range of 2 to 20 meters per second. Pain is interpreted fast and immediate in comparison to other sensations among the body. The information process is rapid due to the motor responses to pain are faster than the motor responses to touch. Pain axons release two neurotransmitters as well in the spinal cord. Mild pain produces the neurotransmitter glutamate, whereas stronger pain releases glutamate and substance P. Pain and touch spinal paths run parallel to each other, however the pain pathway crosses to the contralateral side of the spinal cord, whereas touch information does not cross until the medulla. Thus pain and touch reach at different sites in the cerebral cortex. Similarly, pain-sensitive cells in the spinal cord relay information to the ventral posterior nucleus within the thalamus, and from where it travels to the somatosensory cortex, which responds to painful stimuli and in memories of pain. However, pain is not just a chemical signal. Pain also facilitates awareness, guiding adaptive behaviors. And when you look at it from an early point of development in humans, it teaches associative learning to avoid similar experiences in the future. Pain is a necessary motivator for individuals to withdraw from a dangerous environment. However, pain is also subjective in nature. Chronic pain occurs when the pain extends past the expected period of healing. Pain can also be visceral and hard to locate. It can also be deep somatic pain stemming from areas of mobility, or it can also be superficial. But a big problem that occurs is neuropathic pain, and that causes damage to the nervous system. Phenomenon is known as phantom pain, which is a neuropathic pain where there is still pain sensation from the removal of a limb after the brain receives no signal. When we take a closer look at the brain regions associated with pain and emotion, there appears to be an activation of the anterior collingular cortex. The ACC has been positively correlated with anxiety, stressful life events, and even a history of abuse. The research suggests that it is very important that the early emotional experiences help facilitate pain responses. Painful stimuli also activate a path that goes through the reticular formation of the medulla, the amygdala, hippocampus, and into the collingular cortex. These areas react to emotional associations. So if you're watching someone you care about in pain, you feel and experience sympathetic pain. Empathetic responses play a very crucial role in society as it is necessary for bonding within a relationship. Green and colleagues 2009 found that observers with higher self-reported empathy who were administered experimental pain showed much higher levels of pain. Research conversely also found that high empathy conditions applied to themselves are more intense and unpleasant than people who experience low empathy. A study conducted by Lamb and colleagues also found that observers experiencing empathetic distress for a person undergoing a procedure manifest facial expressions only when they were instructed to imagine themselves experiencing the procedure, but this did not occur when they imagine a patient's feeling. But this still leaves us with the problem of how do we help emotional pain. Lumley has suggested that an adapted ancient form of Buddhist meditation known as mindfulness has shown clinical promise. The promotion of transforming anger into compassion has been found in Kingston and colleagues' study for individuals to have greater tolerance to pain when they use mindfulness-based stress reduction, particularly among the adult population with low back pain. So the next time you feel emotionally hurt, please understand that although it is not always physically manifested, the pain responses that are associated can be. Cognition and perception of pain are both chemical and behavioral. It is not all physical, but the brain interprets it as such. It is clear that pain and emotion overlap.